Okay, good evening, everyone. So we are already late, but we will stick on to our 7 p.m. time. We have some personal commitment which has entered into this, but even though, okay, last 3 episodes, we made something better, and this will be like a different session. Why? Because we are just moving from our mental health to our communication series. So, welcome to VC and Cathy podcast. So we proud to say that we are in the episode of 4, and this is the marvelous thing that we are going to speak about the communication. When we speak about the communication as a nurse, as a healthcare profession, it is very important for all. It is not only for professionals to manage with the communication. But even though today we will speak specifically about a difficult patient, so it is not easy to communicate with our patient because when there are two lovers sitting together, they will may have some problem because of some communication issues. But think about the third person who is in the hospital with lot of stress and anxiety is going to manage it by a nurse or a doctor or any kind of healthcare professionals. How it will be very difficult. So today, Cathy, so this is a time we are going to reveal about this communication thing and how to manage everything. But before enter into our episode, I want to start with our very wideable and very good performance about VC's Connect. As we have started this VC's Connect from episode 3, and I think so this will be persisting for long videos for the further moments also. So the first thing I want to say, thank you, Cathy, for this episode 4 also. And we love to do the same episode in the name of episode 10 or 100. So we still together to perform with the mental health thing. And thank you for everyone who has joined and who has messaged like it is already 7:10. You didn't join. I love that comment. Why? Because they are all stick to our 7 p.m. time of Saturday, but we are not. But even the as a mental health professional, Cathy and I'm educator working in the simulation are not following the time. It is very bad. But even though the next time we will be make sure we will be on time. So first we go along with the VC's Connect, Cathy. So the first it is the one word that describes a very good nurse. I don't want a definition from our nursing book, Cathy. I need a specific answer from you because I know you are a lecturer and you will be speak more about the knowledge part, but I need your opinion on this connect. The one word that describes a good nurse.
Compassionate.
Compassionate. Okay, so that's a little bit different from our curriculum. I think so. We have studied very different aspects of our nursing profession, but now it is a different one. Thank you. The one communication skills every nurse should master it. Any kind of communication skills.
People should develop a lot of communication. The one I would recommend the more would be active listening.
Oh, that's a good point. Why? Because I am failed in the active listening. So it is very important for a nurse to do a listening part because when they go to abroad also they have a segment called listening session. Why they kept in the sense when you speak to a patient, the listening is very important. If you are not listening properly, then it will end up in some other chaos because of our communication issues. That's a great answer, Cathy. Have you ever had a difficult patient interaction that taught you something valuable?
This should be answered in one word or cannot be answered.
Anything. It's depends upon you.
Okay. Coming to difficult patient interaction, not be something valuable. I can't specify one patient interaction because we learn gradually. So to be more specific, I say the entire patient whom I encountered during my student life. Because as a student nurse, I felt it very difficult to communicate with my patients. Sometimes to enable the trust in them. Even if we say something, they used to ask for a clarification from the ward staff nurse or the nursing officer. Or they might even ask whether it's true or not from our tutors or assistant professors. So I felt
Mhm.
very difficult to build a trust in a patient as a student. That is where I learned like trust is not built all of a sudden because
Yeah.
they are with the staff nurses all over the time. These student nurses only get exposed for a little of time. So trust develops gradually. That is what I learned as a student nurse. Building communication doesn't mean giving information. It is all about
Mhm.
building trust and rapport gradually.
Okay, that's a great answer, Kathy. So I think so. Most of us doesn't know about the trust. So when we build a segment of trust with the patient, at the end of the discharge date, they will say, "Yeah, you are a very good nurse." To get that one word, we need to struggle for a 10 days, 15 days of care to the patient. That's good. So now we are going to our topic specifically. I need to understand something, Kathy. Why is communication considered as a core nursing skill? Why? Because we have a logbook that is given by our nursing council. We have many kind of skills to be developed as a nurse. But why this communication, the specifically this matter, it is very much considered as a core model for each and every nurse.
Okay. Though communication is not mentioned in law as a procedure, we have one segment. We have curriculum based on communication. In nursing foundation, we have unit for communication. In communication
Hmm.
and education technology, we had a unit. Maybe current syllabus doesn't have, but we had a standard.
Hmm.
And
Yeah.
even in psychiatric nursing, we had a separate unit therapeutic communication. So,
Yeah, the
uh,
communication in the psychiatric and mental health is a different level. We can't compare it because the communication matters with the psychiatric patient. Why? Because even though we are the normal human being who is with the mindset of the healthy mindset, we couldn't understand who is speaking about us and what is going on. But when think about the mental health patient, oh my God, it is very frustrated for each and every nurse to understand those things. Yeah, please continue.
So communication, even the council has given importance. The Indian Nursing Council has given importance in the curriculum. Why communication is
Mhm.
such an important thing is because it's such a very crucial thing. It
Mhm.
communication is not only with the patient; it is with the healthcare, other healthcare professionals, be it nurse, doctor, or your colleague, or a
Yes.
nutritionist, or a physiotherapist, or a pharmacist, and with the patient family members. Without communication, we can't do anything. This
Yes.
is the very crucial thing where we can get to know patients, where we can explain things to the family members, where we can
Mhm.
have advocacy over the patient's thoughts. Only when we communicate properly, patients will open up with us. Especially more than telling communication, first is the essential or very vital thing is building rapport with the patient. That is very essential.
Mhm.
That is
Yes.
what will lead way to good communication. And especially when it comes to nurse-patient relationship, uh, or else called as therapeutic relationship, it is very essential because we plan things with patients. We just not only ask the patient to implement what we want to do. We plan it
Mhm.
based on their needs. To know their needs, we need to speak first with them. So that is where we communication plays a very vital role. Without opening up or without the patients explaining us their needs or without us listening to them, we won't be able to identify their needs or we won't be able to plan our nursing care. So
Yeah.
that is where
Yes.
communication is a very vital role and it is very core concept for nurse to develop in herself or himself.
Yeah, understood perfectly, Kathy. So why it is very important in nursing. And I need to ask you the another question to understand about this communication. So what are the most common communication challenge the nurse faces daily or rarely also? It is not only for the nurse, I think. So the students nurse also involved in the clinical posting. So what are the major communication challenges?
Okay. When it comes to communication challenges, it is not only on the way they communicate, it depends upon the workload of the nurse. The first one is time constraint. So a nurse
Mhm.
having 10 patients cannot communicate properly with all 10. Or if she has critically ill patient and a normal patient, her time variation, concentration on the patient differs from. We care a lot for a
Mhm.
critically ill patient, and we don't care that much more for a normally a person who is normal. So only that person can communicate even more well than a critically ill patient. So first
Yeah.
thing, a challenge for a good communication is time constraint for the nurses. Since they have a lot of patients, they can't spend more time in understanding patients. They only have time in doing their work or whatever is intended to do, like giving medications or doing some procedures or maintaining charts or putting notes. So time constraint is one challenge which is very common barrier for communication. And the second one is jargon, medical terms. Patient might
Yeah.
not understand medical terms, and so we
Yes.
must be very careful in our work words. We should not use more complicated medical terms while communicating with the patient. The patient will himself lose their interest to listen to us while we are communicating in such a way. So our language should be very simple. We should not use more medical terms while communicating with the patient. That is one more barrier. To say, we have also cultural barriers and language barriers. We differ in culture, we differ in gender. So that are the major communication barriers. Language, if we are not able to understand their language or their slang, what they are
Yeah.
trying to express to us. And even when it comes to cultural things, some things might not be that important in our culture, or we might be neglecting that in our culture.
Yeah.
For the patient,
Yeah.
that might be very vital or crucial thing. So these are the challenges which a nurse will face while establishing a good communication with the patient, like time restraints, medical jargons, and language and cultural background.
Yeah. So when you speak about cultural barriers, there are many things are there. In India, as we know, the different state manages some different kind of cultural habits and belief. I need to add one more point. Like when I take my wife to the hospital for the X-ray, so we all know, as a nurse, as a healthcare professional, we know that we need to remove everything, every jewels, to before taking X-ray. So when that attender, inside that X-ray attender, the person, he said to my wife to remove the Mangal Sutra. So that time, my wife didn't think about anything. She removed it and she went inside the X-ray room. That's because we are a nurses. We know what is going to be happen in the X-ray. So, but if anybody else from a different profession, so maybe some people who doesn't understand what is going to be happening inside that room, they will be making that scenario different. How you can tell my wife to remove this one, or if that same wife can ask to that attender, how you can say me to remove my Mangal Sutra. This happens in each and every state and union territory of India. Why? Because we carry a different habitual belief. So that also plays a major role in this communication. How we communicate with our patient, how we communicate with our difficult patient. So that's great, Kathy. That I need to know about one more thing. How should we, as a nurse, I can go and handle my angry patient who doesn't hear about me, who doesn't want to take medication, who doesn't want to go for the further treatment or something else, and who doesn't. Some this will happen, Kathy. Um, when I was in Delhi, what happened? The caste thing it was there. My name is VC Nandacumar. The end name it is called Kumar. So in North it is different. When you come to the South, it is totally different. In North, the Kumar name it is aligned with some kind of caste. And I doesn't know when I was working with the North Indian hospital. So I was thinking, okay, what? what it is something different. They asked me, Kumari, you're from this particular caste, please don't touch me. They said
Okay.
me, please don't touch me. And I was like, what's the problem? As a nurse, I also eligible, I also have a capability to do a care to my patient. And they went enter into the hospital, they also sign with everything that I can get care from a nurse, I can get consultation from a doctor. Even though they are thinking about this casteism and the community, they make their particular community to touch and give a care to them. So when you speak about this culture, I was thinking about the same, how we will manage this particular one. And I need to know about how we can handle an angry patient.
Okay. When it comes to anger, it is like moreover managing a patient with aggression. Anger and aggression are almost related. First thing is we have to de-escalate their aggression because anger always matches with our energy. The more energy
Okay.
we give, the more the anger the patient gets. So the first rule is the low and slow down. Lower your voice and slow down the conversation. You need not
Okay.
be equally as active as the patient is. Once you low down,
Mhm.
or automatically their anger has to match to your voice, your tone. So first,
Mhm.
lowering our tone, lowering our pitch, our volume, and pausing is very, very essential. Next is pause for
Okay.
3 seconds. Like once you
Mhm.
pause, suddenly the patient might not have time or consent to speak over with you. Once only when you give back to back answer, the patient have that content to increase their voice or to shout over you. Once you pause and
Mhm.
you listen, automatically they don't know what to say or how to
Mhm.
proceed further. So they too will
Mhm.
automatically slow down at that time. And then
Mhm.
you start speaking in a very low tone and you ask what is the need for them right now, what you need.
Okay.
So
Okay.
that is where you have to assure the patient that you will be listening to them. Even if they
Mhm.
shout at you, you will be listening. You are
Yeah.
here to care for them. Not you're not here to be aggressive, or you're not. You should also make sure that you're not a slave or someone or their servant to just go and adjust with their anger. You can also move on
Mhm.
if the patient is angry. You can pause and then you can speak out to them so that you give time for them to calm down. That is one of the things. And you were speaking about a patient not cooperating with treatment, and so that actually comes in an ethical dilemma. Recently, I was discussing this with my students because if a patient has to take insulin but is refusing food, what will you do?
Yeah.
Whether you will give insulin without his food intake, if you give insulin without his food intake, then uh, you're doing something harmful to the patient. You are doing some
Yeah.
non-malnutrition to the patient. And if you
Mhm.
don't give insulin also, if the patient is not taking food, again you are harming the patient. So I was
Yeah.
this was actually an ethical dilemma. I was teaching about ethics, and I just gave them a scenario. What you will do? This is the ethical dilemma. You have to give the patient. You have to respect the autonomy of the patient, and
Mhm.
also you have to not stop the treatment. So what you will do? Yeah. So that is where you have to first explain the need for insulin to the patient. And you
Okay.
should also get to know the reason why the patient is avoiding food. Maybe the food is not palatable to him, or it is
Yeah.
served very hot or very cold. Why he rejects that food?
Mhm.
You should know why he rejects food, or it is something else. Maybe he might not eat that food if it is hospital served. You have to get another food serving which goes according to his culture or something, because some people might see onion, garlic, they won't eat. And if they see
Yeah.
it in the food, they might refuse to take it. They won't actually spit that out, spit the reason out. So first we have to know
Mhm.
the reason why the patient is rejecting the food, and then we have to explain the need for insulin and why the patient needs to be injected with insulin, or what might be the post complications if he food and skip insulin. And if you're not able to do that on, then you have to communicate with the doctors. You have to maintain a regular glucose monitoring. Maybe we can start insulin on therapy, steroid pump, and continuous monitoring of CBG. If at all the patient keeps on refusing, we can go with total parenteral nutrition. We have lots of options. So everything comes with communication. First thing is other options are which goes on with treatment. The first thing I told is you have to communicate with the patient and know the reason for rejecting the food. So when they reject the treatment, it is essential for a nurse to know why they are rejecting that. What is the thing which concerns them to cooperate with the treatment, or why they are avoiding that. So as a nurse, they might not be spending more of their time with the physician. We as a nurses spend more of the time with the patient. So as a nurse, we during our free time, we might consult the patient, we might consult them, we might counsel them regarding that treatment and why it is very essential for them to continue, why it is essential. At the same time, we should also respect their autonomy. So once we respect their decisions, they used to agree, and majorly we have to give respect for their decision making skills. We should not take decisions on our own for the patient. So this is what happens. Like for an anger patient, you have to de-escalate them by your slowing down your tone and your energy, because anger always matches the opposite person's energy. If we shout, they too will shout. Once you calm down, the anger has to match our low tone. So they too will calm down. But we should not say calm down in a loud tone.
Understood. So rather we want to specifically say to them, we need to adapt something as a nurse. I need to calm down and I need to speak with a past mode so that I can understand and slow down their anger. When you speak about this particular example, I could remember something. Why? Because I'm practicing simulation now. So in simulation, there are many communication things that is happening. I can remember one point, like people say that when something is happening or it's not about only the patient, it's like a friendly conversation with the friends or any conversation with the wife or husband. So the person who is very angered, very angry mode, we need to speak their feet. When you see their feet, automatically they will not speak louder and they will not continue that angry mode like that they have mentioned it. So it is little bit different, and I tried it so much, but it is not happening. But even though we need to prove something scientifically, I made those things in my family, but it was not reduced. But even though instead of that, she asked me, "What water is seeing in my feet? Do you want something else, and you want to pull down me?" Okay.
Even
So
after
it's
contradicting what you said, like looking at the feet, they might get more angry. I'm speaking to them, is looking
yeah,
something else. That's
right,
what they
yes.
thought. So we should not move on eye contact at that time.
Yeah, they want to look at their face and they need to speak. Okay, handle my anger. Please
They
handle
don't
it.
look at their feet like this and stand.
It's very funny. And one more thing. So we need to, how you have said, like for the angry patient, what I need to do and how I can manage it. I want to ask something. What should we avoid? I need something point like avoiding something. So when somebody is very angry, the patient is very angry. As a nurse, what I need to avoid that? You mentioned that we need to do this thing rightly, but what I should not do at that moment.
You should not raise your voice. You should not tell the patient to calm down. That's what you
Yeah.
should avoid. Because if you ask the patient to calm down, or if you don't listen to the patient, or if you speak again above their voice, if you raise your voice, it increases their aggression or anger. That's what you can do.
Yeah. Yes, of course. When somebody is in angry mode, if we didn't listen, you said something rightly at the initial beginning of this portion, yeah, like an active listening. The active listening is also, it is not only listening to the patient, it is also in the chaotic situation. We need to manage it by listening something else, what that patient is telling to me, what that attender is saying. Like you gave example, whether the food is very hot or the it is very cold. Okay, it's a kind of thing. As a nurse, what I need to do is I need to listen it perfectly, so that what happens if patient is also at a very angry, so I can understand. So one thing I need to add here, we need to find out why the patient or attender of the patient is angry. We need to study about why and how and what. If we know about these three, we can solve a entire math. The background of that angry math, we can solve it, and we can find the solution also. But never ever, as a human being, we are doing this thing. We are not thinking why it has happened. We are not thinking how it has happened. We are not thinking what has happened. But we will shout at something. What? No, this is correct. This is my portion is correct. Now, what I'm saying it is correct. You are absolutely wrong. We are speaking like that. So this mannerism is came to a nurse to speak with the patient also. If patient is saying, yeah, this insulin it is 10 cc only, you need to give something else. But as a nurse, I didn't verify in the medication chart, but I loaded 15 cc something. Okay, so that time patient is saying to me, but I, as a nurse, I'm not accepting it. Why? Because the mistake is with me. But even though there is a ego clash, it is there. As a patient, how you can say to a nurse, or else if I go to some hospital, I'm showing something scan report of the previous hospital, and they will say, no, I want to see the scan repeatedly. I want to see it again. But as a patient, what we will say, no, already have this one. As a protocol, as a council has said, this is 3 days, it is valid. You need to take this scan. But doctor will say, whether you are a doctor or I am your doctor. So this happens mostly. So the ego portion is also a part which, as a nurse, we need to avoid. Not as a nurse, as a human being, we need to avoid it. Yes, yes.
One thing when you told about scan, I would like to mention many orthopedicians, each and every time we go for second opinion or something, they refer for a new X-ray, and we are getting
Yeah.
exposure to radiation a lot due to that.
This X-ray problem also created with my sister's baby. It is a twin baby, and baby has something like a lower respiratory tract infection. That time she took her to the doctor. One doctor said it might be something asthmatic, maybe a chronic asthma. The other doctor said no, there is some problem, abnormalities which is present in the lower part of the chest. Then she was like, oh, what is going on? And that first doctor said her to take an X-ray. That is day before yesterday. And today she's taking her child to a different doctor. That is the second day of the first consultation. Now the same, the another doctor is telling my sister to take another X-ray. And my sister called me and she asked me if there is a frequent exposure of this radioactive particles that will affect my baby or not. As a common people, she is asking me that these are all the problems may occur. If this thing she is going to ask a doctor, doctor will say, you are just a patient, you are just a patient of the attender, and how you can say to me that I should not take another X-ray, and they will be saying something else. This happens in our IC and ward day to day. When I was a student nurse, sometimes nurse will have this ego clashes with the patient. How you can say to me, I know everything, I studied degree, I did my masters, I did my PhD. Then also they will be thinking, okay, I'm a god. No, it is not about the god. It's the person who need to listen something else what somebody is saying to us. That's a common elegant active mode as a nurse we need to have. And how you can calm down, Cathy? You said many things else to us, but I need to ask you how we can calm down as a nurse. I can calm down myself. You said like lowering the tone and keep a pauses in between the sentence, but you have something else to say us, like to add on some points to us.
Maybe how we can calm down is we can count like what we actually say to patients. We can also practice what we preach. We
Yeah.
can also count in our, within ourselves some 10 to 1 to calm down us, maybe not the patient, to calm us down so that we don't raise our voice in that situation or
Yeah.
avoid more of a talk or conversation at that particular time. Allow the patient also to pause and for us also to pause. That is where the giving pause, the patient might be in a flight and fight response. The sympathetic
Mm.
nervous system will be working. Once we give a pause and we ourselves give pause, even we will be in the flight and fight situation. Automatically, when we pause, our sympathetic nervous system will shut down and our parasympathetic nervous system will start working. The rest and repair phase will start down. So both the patient and us will get normal. The rest and repair part, I mean the parasympathetic nervous system will start working and automatically we'll get calm. So
Okay.
pause is
So,
very essential, and that pause
yeah.
can be given by counting within ourselves or just avoiding the situation for a minute or drinking water or something.
Okay. Okay. So you have mentioned about the trust in the beginning of our session. I need to ask some, do you have any strategies that help to build trust with the family members? And there are some lot of problem is will be going with the attender of the patient and the nurse. Okay. I need something like how to build a trust with a person.
Okay. Building trust is first thing we have to be honest. When the patient asks or the family members when they ask where is the doctor or when will the doctor arrive, instead of saying the doctor is arriving soon or he'll be here within 10 minutes, we can just be open and honest. Like the doctor is in surgery, will end in an
Yeah.
hour.
Yeah.
He will be after that. Or the doctor is out for a lunch. Once he completes his
Mm-hmm.
lunch, he will be here. Something we should always be honest with the family members and timely updates instead of just giving information when they ask. We can update them time to time, like this is what I'm doing, this is what has changed, or morning we would have taken a blood sample from the patient.
Yes. Yeah.
We need not wait for the patient or the patient's family members in the evening to ask whether the result has come. Or we would have even taken a blood sample for culture. So while taking
Yeah.
the samples, we can give information like this result will come only after 3 days. Then the patient will
Mm-hmm.
also wait for 3 days instead of on and off asking you for the culture result. And if it is a result which would come within 2 hours or 3 hours, before the patient asks you for the result, you can go tell the patient the result. So timely update or
Okay.
giving information to family members will develop trust.
Mm-hmm.
And the next one is not giving positive reassurances. If the patient
Okay.
sometimes say that you said that it will go on well, it will become fine or so, but that
Yeah.
hasn't happened. Instead of if you give positive reaffirmations or reassurance and that doesn't happen, the trust what you have built so far is great. So you have to not give positive reassurances without the possibility of that incident happening. For example, after a surgery, we should not tell to the family members that he'll be walking in 2 days or things. You have to tell them what exactly is the situation, how long it will take for the patient to mobilize and everything. So being honest, giving timely information and not giving positive reassurances without giving false reassurances will enable you to develop trust in the family members as well as the patients.
Okay. When you say about this timing, also we need to see about the practical reality. As you said, doctor is in surgery. We are saying that within 5 minutes or 10 minutes, doctor will be coming. But it is totally unfair that the surgery may extend. We doesn't know. Only God knows. It is not about the surgeon also knows whether that will be extend to the another half an hour or 1 hour. But even the as nurse, we should not say that it is 5 to 10 minutes he will be coming. Never ever happens. So we need to see the ground reality. What can be happen? If you stuck in the traffic, you can see the Google map and says about it is 30 minutes. You can say to anybody else, like your friend, yeah, it is 30 minutes, I will be reaching there. Instead of that, I should not say like, yeah, within 5 minutes or within 10 minutes, I will be there. It is a false assurance that I'm giving to my close person also. It has happened with many people, like they are saying something to the family, their personal family. And it also happens with the nurse and patient and their attender communication. And why, as a nurse, I'm having these much of misunderstanding with the family members? Why it is happening?
Understanding with the family members. One
Yeah.
thing is not proper communication, effective communication.
Okay.
Like we speak something and they understand something in language. There comes the communication barriers working between a nurse and the family member or the patient.
Mm,
So that is
yeah.
one thing. The communication barriers will play a very major role in misunderstanding. And the next role is the patient or the family members would have a second opinion, or they might search next internet, social media for information, and we see something which contradicts that, automatically they have a misunderstanding. Like we might
Yes.
tell it might happen 1 week or something, but social
Mm,
media countries say more less time than a week. So there, the patient family members will automatically will not trust us. There will be a misunderstanding, like this nurse is lying to us or something. So this one is a very major thing why misunderstanding happens between family members. Too many information are available for them, so that they
yeah.
don't seek our part of information. They need clarifications. And instead of
Mm-hmm.
clarifying their doubts, when we say do what I say, or this is need to be done, like automatically it ends up in misunderstanding.
Yeah, of course, that happens many times because now we are in the world which has a Google era, Chat GPT era. It is developing now. We have many things. You can also see, Kathy, when students enter into the practicals, they will be just check with their Chat GPT or Claude, any kind of the AI GPTs only, not with the book. The author will be thinking, oh, instead of creating a book, I can create something like a chat GPT. So it is like that. Even though now also we are speaking some content, it is based upon the chat GPT. When you see some TV, they are also using chat GPT. Nowadays, the PPT presentation, it is also the many kind of AI models. They are just copying and they are coming and entering into a classroom and they are taking. It is the era like AI has entered into us, and many thing it is available. The people is not worried about anything. They have many information, lot of information, what to done, what type of surgery it is. Instead, my relative asked me about if there is any problem with this organ, what will be done as a surgery. If I have forgot something else, okay, I said no, it is not necessary surgery and all. And he is replying back to me that no, I have seen in the Google that there are 3 to 4 surgery it is available. I was shocked. Okay, so you have Google in the hand and you are testing me that whether I am just telling you or not. I studied 8 years before the medical surgical nursing, and now you are asking about the surgery, particularly that particular surgery. It why what it is that and why it is happening? Yeah, I'm a nurse. I'm not a surgeon to think about. If you ask to the surgeon also, he will just refer some books and he will be let you know. It is not everybody knows about this thing. The people mindset is when you are into the healthcare profession, they will think we know everything. But when they have admitted as a patient in the hospital, that time we doesn't know anything and they know everything. That is the reverse thing. It is happening nowadays. I need some practical tip also. Yes, yes, Kathy, please.
Chat GPT, I never believe Chat GPT at all, because
Mhm.
Like 1.5 years back, I just asked ChatGPT for a reference review of literature for a study,
Okay.
and it gave three review of literature. Well,
Okay.
I wanted to put reference in Vancouver style, so I went searching for that particular journal. There was no such journal, no such study at all.
Oh.
That really stumbled me, and that's the point where I stopped using ChatGPT. Usually, I don't use ChatGPT. I use it
Okay.
like a conversation or something to create images or something like what I need.
Mhm.
I only use ChatGPT to create images. Like coming to asking content, I can't rely on ChatGPT because it creates false information and it presents it to us like as if it is true with the scientific base or evidence it has. Even if you used to give some link and we if we go search there won't be such a link. The page will be an error and something. So I always go for Google search. We have search pages, search engines like Google Scholar or journals like that.
Yeah.
So I always use them. Even for communication, I was searching for journals based on communication. I just put a topic, suggest me journals which speaks a journal topic which speaks about nursing communication as a core concept. That is where
Mhm.
I started developing my knowledge in communication. So if we ask ChatGPT, it presents even life as if it is the truth.
Oh, okay. So, yes, of course, the artificial intelligence has their positive or negativity, and I understood that what are the things you faced because there is no any reality it is happening in the AI. Artificial intelligence is a kind of that it develops its intelligence uh, by us. It will speak to me and it will gain, okay, what are the things I'm speaking to you? It will refer to the Google, it will refer to this particular website and it will say. And we don't know whether it is real or it is fake news. But even though
Yes,
there are some positives are there, when you say about the images, the sometimes what happen if I say ChatGPT to create a image that a nurse is inserting an is a syringe needle to the deltoid muscle. What it has given to me is the patient is wearing the entire dress, okay, and there is a very big hole here. I was thinking, what happens to my patient? Then it has created a hole in the patient dress, okay, and it is inserting the syringe. Sometimes it is very funny and joke when we see that AI is not going to replace humans. We know,
yes,
but
it's going.
never ever it is can't. But doing something work faster, the AI will be helping us. But this AI is also will be create some problems also in future. Yeah. Okay. I have some practical tips that I need to get it from you. What communication technique will work best for a nurse?
That's what I told in the first. Active listening is very good communication technique.
Okay. Active listening. Okay. I think so. I'm just weak in the active listening now. Yeah. So as soon as we need to listen actively what the patient is doing. Okay. How
Do
can
not
nursing
judge,
students?
actually. Do not be prejudgmental. You listen
Yeah.
and then judge.
Yeah. Yes. Of course. How can nursing students improve their confidence in communication?
Practice makes a man perfect. So instead of
Mhm.
fearing to speak to a patient, even if they are wrong, they can go speak to the patient. They might think if I start speaking with the patient might ask a lot of questions to me. What if I don't know the answers? So there's nothing wrong to say to a patient that I'm in a learning period, I'm in my learning era. I don't know about this. I will just go ask my tutor or ask the staff nurses and let you know, or I'll refer my book. There's nothing wrong in telling that I don't know. Instead of
Yes.
just blabbering all the lies as if you know everything. So instead of building something a false or glass building, you build something very strong that make practice. You approach the patient, do not fear of talking with them, and then also make sure that you give the correct information to the patient.
Yeah. Yes. That's great. So when we speak about nursing students, Kathy, and for the nurses also, I will suggest some tools that is used worldwide. The one it is called as ISPAR tool. We studied about this ISPAR when we are in the education period. What ISPAR is saying that how to introduce yourself to the patient, and this sequence will create a perfect communication to a patient and nurses. So what happens is whenever we speak to a patient or whenever we speak to our professional like doctors or any pharmacists, we will miss some point. Suddenly I will call and I have seen some reel, Kathy, in the Instagram. I don't know about that movie. Uh, yeah, this is that it is recently came, the Hindi movie. Okay. So what happened is a nurse is standing and senior resident is there and he is calling to a HOD of that particular department and he is saying, sir, this is Mr. Raghav and my patient is unit 7. That's it. And then he is asking what I can do without telling what is happening about the patient, and he is asking what I can do. And this doctor is realizing that is any nurse is available nearby, and that senior resident has handed over the phone to the nurse, and that nurse who has acted, Kangana has acted as a nurse, and she has elaborated everything. Sir, my name is this, and about the patient, patient name is XRY, and patient is admitted for this particular condition, and patient has gone for the surgery before 2 years, the past thing, and what I can do, and this is my recommendation. This frames a perfect is bar. Introduction, you're going to say about yourself and your patient, and second, you are going to say about the current situation, what has happened, why you called me, and if I'm calling you, Kathy, like as a friend, I can call you anytime. But when somebody like a student is calling to you and they are, hello, ma'am, how are you? That's it. And he doesn't know what to speak to you. There is a purpose for that particular call. It is not there means it is waste, entirely the waste of time. This situation also deliberate and differentiate the same thing and what is currently happened to that particular patient. And when we see about the assessment, as a nurse, what are the assessment I did? Okay, patient got pain, why it has got, and how it has got, and how I found patient is having a pain. What type of the tool I used there to identify the pain. Okay, and then last recommendation, I can give a recommendation to a doctor. Okay, sir, shall I do this one? Can I start this IV fluids? Shall I give this SOS tablet? So this is how the structure that is formed. This is called as ISBAR. It is universally, that is entirely in not only in India, the abroad countries also using the same technique where you are going to speak to your colleague or your healthcare professional, like nurse to doctor communication, nurse to nurse communication, or nurse to pharmacist, nurse to physiotherapist, anybody else. You can follow the same when you communicate with your healthcare professionals. And another term it is also there, the tool it is called as aided. This is also we studied in our nursing education when we are in the third year and fourth year. So aided is about nurse and patient communication, how I'm going to acknowledge it, and how whether I acknowledge like hi, good morning, good afternoon, something else, and I'm giving my introduction. I understood that nursing student and the nurse, when I conduct some training to them, I will create a scenario to them and they will perform to that particular scenario. What happened is their target and their mindset will think that, okay, I need to complete this particular procedure. Like, for example, to administer some medication to the patient. What happened here is they are focusing only on, I'm going to administer the medication. They forgot how to speak to the patient. They lagged in the communication matter. That's where this communication tools will be helpful for us. And audience, if you want such more information about ISBAR and AIDEN, just search it in Google. That is also not a random Google one. There are many international organizations stated about the ISBAR and the AIDEN tool. And that will help us, Kathy. Really, I use that ISBAR and AIDED when I conduct a simulation scenarios where I speak to the patient that has evaluated and I scored very good marks. And it is not only about the marks, the reply of the patient is also good. I say to my patient that I am VC Nandacumar, or else patient will not know about my name. That particular one also we are missing it. When you speak, when you go to the hospital, if you ask to a patient who has came in the morning shift, who the nurse was giving care to you, don't. Nobody knows. The patient doesn't know. Patient attendant doesn't know. And for current situation, the communication is also not only to maintain a rapport, it is also to introduce yourself to the patient particularly, and how long you will be staying with the patient. I mean, the morning shift means I need to specifically say like 8 a.m. to 2 p.m. or 6 a.m. to 2 p.m. like that. It is not only it starts when you speak about the trust. Trust also builds from this particular point. We are not communicating properly to a nurse. We will enter into the patient room and we will say, turn, I need to inject it. Doctor has gave this medication. No, it is not possibility right. When you see as empathetically, when you stay as a patient in a hospital, that time you can understand what it will be, how it will be. Why? Because when I admitted in the hospital, the same thing has happened. Nurse came and she told, open this one. Yeah, she injected and she went. I don't know what is the name of the medication. I don't know what has happened. She came and the doctor came to my cabin and he asked me, did the nurse injected this medication? I said yes. And he asked me who was injected. I don't know who was injected. I don't know who came here. Anybody else from enemy also will be coming inside to my ICU. They will be injecting into my IV bottle like in the cinema. This may happen. I need to understand that as a nurse, I need to give everything to my patient. It is not only the care. It is not only to complete your procedure. It is all about your rapport, how you are speaking to her, how you are speaking to a patient, how you are speaking to other family members. That is very much important and significant here. And the last one, Cathy, I need to ask you before we enter into the rapid fire. You want to say something?
Since
Yeah.
you told about this ISBAR and AIDET, like you were asking about misunderstanding with patients and all, you
Yes.
can correct with ask them first what they need to know, and you explain them what they want to know, and after that ask
Yeah.
them to repeat back so that you can get to know whether they had correctly understood what you have to. It
Yeah.
clears the air of misunderstanding actually.
Yes. Now I think so. Something it is changing, Kathy. When I work in ICU, 8 years before, 7 years before, I it was entirely different. Now the nursing community has developed. Nursing now the current nursing found many things and they are implementing into their practical. That is the best practices they are doing. I wonder that within the 6 to 7 years they change a lot and lot. It is not a single thing, Kathy. When I speak to a nurse, it is in 2018. Now 2026, if I speak to a nurse, she is replying something is better. It is not we are going down, we are improving it. But one thing we didn't notice it, the salary component. It is not a session that we want to speak about this particular salary. But even though the quality improved, I say the quality and standard improved, but the pay level is also need to be improved. Then only I can entirely put my effort to work there as a nurse to the patient. Or else what happened? I will say, come in, go out. Yeah, yes, remove this particular dress, and I need to inject you. This is a tablet, yellow color tablet, blue color tablet, white color tablet. Take it. That's it. So to avoid this particular thing, I think so. What I'm giving, the same thing it should be written back to me. Then only I can be satisfied. The satisfaction makes that particular standard or quality to improve, or else nothing will be improved. Yeah. I need to ask you one more thing, Kathy. What role does empathy play in patient care? We forgot about empathy. I think so.
Empathy is also very essential. Actually, it is a component of therapeutic communication. We study in
Hmm.
psychiatry. I think there are four components: warmth, genuineness, and in that, empathy is one of the components of therapeutic communication. Because
Yeah.
only when we are empathetic, we might understand the patient's situation correctly, and so that
Yeah.
we don't answer in a very rude way. Once you understand the patient's situation and how the patient feels, our way of replying will be very different. Like we put ourselves in that person's shoes and we think of us in that situation, how we expect the reply to be. So that is
Yeah.
where empathy plays a very major role. When you understand what kind of situation is that the patient is and how a patient needs to be communicated during that situation, when we understand that, it enables us to communicate more in a very better way than we communicate earlier.
Yeah, okay. Thanks, Kathy. So now we are going to enter into the rapid fire. And this rapid fire will be a repetitive questions also. Why? Because maybe some people will not see the entire portion and they will come to the rapid fire and they will listen to the particular point. So I need some repetitive answers also, but I know you are very flexible to this podcast and I'm asking the same repetitive question. That's why I'm saying this before to you. The one communication mistake nurses should avoid.
One communication mistake nurses should avoid is telling the patient to calm down like in a very high tone. You're telling
Hmm.
one, but there are a lot to avoid. You should not
Okay, you can
tell
add.
the
You
patient.
can add some complimentary also. One or two, three, four, five.
Okay. One communicative mistake is to not ask the patient to calm down in a very loud tone, and don't ask the patient to do. You just
Hmm.
suggest the patient instead of make giving your decisions. Give suggestions to the patient.
Okay. Yeah. The suggestion is a little bit. We doesn't know what to be done. That particular suggestion. We will have the same suggestion part in different podcasts. I have many things to say about the suggestions. Why? Because we doesn't have a practice to give some suggestion. It is like we are just targeting some people and say, yeah, do this one, do that one, take this one. No, as a nurse, we need to suggest it. Yeah, I can recommend this particular question to you. How you feel? We are not asking this particular question. How do you feel? No, nothing it has happened. No. Yeah, right. One phrase every nurse should use more often.
You said right now how you feel.
Okay.
You
How?
have to
How?
always ask when you enter the patient room. Better greet.
Mm-hmm.
You always have to greet, and you have to ask how the patient feels, so that you will act according to his emotional pattern.
Yeah. Yes. Of course. The another phase, like the phrase, every nurse should use less often.
Less often is like something. I, I don't. I'm like thought block. What should we use less often? Like I know what I'm doing. That
Mm-hmm.
might be a thing which we should use. You did not give me suggestions. I'm a nurse.
Okay. Yeah. So
That
we need to
might be
avoid those egos.
maybe not less often. We should not use of.
We should not use actually. Yeah. Okay. The last thing, Kathy, your message to the nursing students related to today's topic.
Okay, you concentrate on developing your theoretical skills, like theoretical knowledge or clinical skills. And seeing your clinical skills, the patient might be very attached to you. Okay, this student nurse does a very good procedure. He injects me
Hmm.
without pain. But to sustain that relationship with the patient, you should also have a good communication skills. Only clinical
Yeah.
skills will not help you gain trust and build a good communication, therapeutic relationship with the patient. Your therapeutic communication and the technique also helps you. So,
Hmm.
practice communication also.
Yeah. That's great, Kathy. And we are into this podcast. We spoke about many things about the communication. Communication, it's not going to end up within this 1 hour. It is the practice, how we are practicing ourselves to the patient, how we are practicing ourselves in the family, in between the family members. That also will raise up perfectly. And whenever we speak about this communication, Kathy, and I will think one important point regarding this, when you are admitted or somebody is admitted in the hospital, we will not think about how the treatment has went. We will think about how they treated me, whether they ask me or not. I can, this treatment can be happen in anywhere else. It is not only in India, in other countries also. I can go if I have money. If I doesn't have money, I will go to the government hospital or the private clinic or the private hospital. But one thing patient will not forget, that is a treatment. That treatment part, it is not the surgical treatment, it is not the medical treatment. How they treated me, that kind of treatment is lagging with us. I suggest everybody to do that particular treat. You need to treat your patient perfectly, fine, fair enough. That it's not, it is not going to lower us. They are thinking that, yeah, if I go and speak to the patient, they will think, okay, he is not capable. No, it is not like that. It is like how you are putting your efforts there. So that's why this effective communication will be helpful in everywhere else. It is not only the nurse and patient. Thank you, Kathy, for this podcast. And we will meet in next podcast in the next week, Saturday, 7 p.m. I trust we will start by 7 p.m. I hope, because there are many lot of thing it is happening now, so I couldn't join correctly on the 7 p.m. Sorry for that, but even though the next week we will do and we will start by 7 p.m. Thank you so much, Kathy, and thank you, audience. Please go and subscribe to our YouTube channel, and this video will be uploaded tomorrow morning. You can see it entirely, and you can share to your nursing colleague or your nursing friend or the nursing student, so that it will be helpful for them to remold themselves. It is not that we are just giving you a particular point. It is not like that. It is just a time to remold and refresh you, so that you, when you go to the patient, everything will be changed. Thank you so much for everything. And bye bye, Kathy. Have a great weekend. Audience, you are also. Have a great weekend and happy Sunday. Thank you. Bye.
Bye.